After the introduction of Title IX and the opening of the Boston Marathon to women in 1972, running has become an increasingly popular sport for females of all ages, with female runners now forming the majority of participants in U.S. road races. However, science is just now appreciating the differences between the sexes and the importance of tailoring nutrition, training, and recovery to the needs of female athletes. According to one Dr. Stacy Sims, physiologist and co-founder of Osmo Nutrition, if a female runner follows a general training program that has not been designed to take the female physiology into account, the runner will most likely end up overtrained, slow, and with extra body fat. In short, running like a girl should mean training like a girl. Before we discuss the unique characteristics of female runners, let's focus on an important similarity. For both men and women, the building blocks of endurance performance remain the same: aerobic capacity or VO2 max, running economy, and lactate threshold. Improvements in any or all three of these components are responsible for reaching the desired performance goals of the athlete. Highly trained male and female athletes often have similar physiological profiles, and a study of performance-matched male and female marathon runners had approximately the same VO2 max. However, we will now discuss some of the differences between male and female runners that must be taken into consideration when working with female athletes. Females have unique structural factors such as a wider pelvis, shorter legs, more oblique femurs, larger ratio of leg weight to body weight, greater fat deposition on the thigh, and greater carrying angle of the arm, which may affect technique. Anatomical differences that are unique to the female athlete contribute to biomechanical differences that ultimately affect form and function. One fundamental difference between men and women is the pelvis. Typically, a female pelvis is wider than the male pelvis, and its shape is the basis for the lower extremity alignment gender difference. An example of these differences is a proximal mechanical difference, such as increased femoral anteversion found in women combined with a hypoplastic vastus medialis obliquus muscle and genu valgum. This sets the stage for external tibial torsion, pars planus, excessive forefoot pronation, and heel valgus angulation found in the distal extremity. This alignment pattern is important for female runners who rely on precise biomechanics for optimal performance. When considering male and female differences in runners, we must look at muscular strength. Muscular strength of girls and boys changes dramatically with the onset of puberty. Pre-pubertal female runners are similar to male runners in regards to aerobic capacity, muscle mass, strength, and overall sports performance. For example, an 11 to 12-year-old female has approximately 90% of a boy's muscular strength. During puberty, female adolescent runners begin to experience changes in body composition and form. In 15 to 16-year-old females, muscle strength decreases to approximately 75% when compared to their male counterparts. In this population, the female triad of eating disorders, menstrual dysfunction, and osteoporosis become increasingly prevalent. Muscle fiber and muscle cross-sectional area of women average 60 to 85% of those areas in men. And on average, a female has about 2/3 the strength of a male. Greater muscle mass and chest and shoulder girth in the male account for differences in upper body strength, while the shorter relative leg length of the female allows them to more closely match that of the male in lower extremity strength. A comparison of measured peak torques of the elite male and female sprinters reported that male sprinters had 50% greater hip flexion torques and 42% greater hip flexor torques than females. Both knee flexor and knee extensor strength was about 50% higher in the male sprinters, with plantar flexor and dorsiflexor strength about 30% greater in males. Some of the metabolic differences found in male and female runners are due to the female anatomy. Females have greater fat stores, both by having an average of 10% more body fat, but also by producing greater utilization of fatty acids as fuel and greater FFA oxidation. The presence of estrogen, which is lipolytic, acts as an antioxidant and produces greater resistance to fatigue, which allows females to maintain a higher work rate for longer during ultra-endurance exercise. One reason for this may be the result of a slower rate of muscle glycogen depletion, allowing females to perform better than males in long-distance running. When male and female athletes were matched on their performance on a standard marathon, males showed a tendency for larger performance decreases with increasing distance, and the females outperformed the males at the 90-kilometer distance. The muscles of females are also less prone to damage during running due to the effects of antioxidants and estrogen. Estrogen performs a number of protective and performance-enhancing roles. Estrogen has a powerful effect on red cell metabolism hexokinase. It also facilitates increased oxygen delivery to the working muscle, and less damage has been reported in female muscles with eccentric exercise due to the presence of estrogen. Some of the nutritional considerations of a female athlete have to do with the menstrual cycle. After puberty, female athletes have unique nutrition considerations. Just prior to the menstrual cycle beginning, about 5 to 7 days before it starts, the female runner may feel achy, unable to hit intensities, have poor sleep quality, and may be less tolerant to training or racing in the heat. It's during this time that estrogen decreases the body's ability to access carbohydrate, increases the reliance on fatty acids, which means that the athlete can't hit certain intensities during training. It also increases the progesterone, which means that the athlete will hit fatigue sooner and may be more predisposed to hyponatremia. To help reduce some of these ill effects and to maintain performance during menstruation, female runners should consider eating foods high in magnesium, zinc, iron, and omega-3 fatty acids. Branch-chain amino acids, also known as leucine, isoleucine, and valine, promote muscle protein synthesis and increase muscle growth over time and can also help prevent fatigue. These amino acids do cross the blood-brain barrier and help reduce nervous system fatigue. These amino acids can be found in meats, dairy products, chicken, and eggs, and help to reduce the estrogen-progesterone effect on the central nervous system. Progesterone breaks down the muscle and inhibits recovery after a workout. So to help kickstart recovery, protein should be consumed within 30 minutes of finishing a training session. Current recommendations suggest an adult female runner should take 20 to 25 grams of protein within 30 minutes of finishing a training session, with a daily consumption rate of 1.8 to 2 grams of protein per kilogram per day. This will not only help to kickstart the recovery process, but it will also help to promote cellular healing. Another consideration during the female cycle, when hormones are high, the athlete should consider increasing carbohydrate intake to approximately 1 gram of carbohydrate per kilogram per hour. And during a low hormone phase, which is typically the first 2 weeks of the cycle, the athlete can go just a little bit lower and consume approximately 0.8 grams of carbohydrate per kilogram per hour. When working with female runners, it's important to consider training. Just as the performance basics include aerobic capacity or VO2 max, running economy, and lactate threshold, the absolute capacity in the female runner may not increase with greater increases in training, and females have the ability to hold a higher percentage of maximal pace, which should improve with training. Running economy, or the amount of energy it takes to run a consistent pace, is improved in both male and female runners after resistance training. Just like the fuel economy of your car, improved running economy helps the athlete run faster for longer periods of time. Lactate threshold training, which trains the body to be able to neutralize lactate, is another way to improve the ability to run at higher percentage of maximal pace. Examples of this would include interval training at lactate threshold pace, which is about 10 to 15 seconds per mile slower than a 5K race pace. This will spur improvements in lactate threshold. It's also important to allow time for recovery, which we will discuss on the next slide. When working with any athlete, recovery is an important part of any training cycle. Sleep can be interrupted more often in women than in men due to changes in the hormone estrogen and progesterone, as well as potential family considerations. When you add hard training into the mix and the systemic inflammation that comes with it, the elevated cortisol steals estrogen and progesterone, further interfering with sleep and sleep architecture. Poor sleep equals poor recovery. It's important for female athletes to plan rest and recovery and to be sure that they actually engage in it. It's also important to gradually increase the intensity, duration, distance, and type of training, only changing one thing at a time. It's also important for female athletes to pay attention to their nutritional needs as the hormone levels cycle and change throughout their menstrual cycle. All of these things can go into appropriate recovery and help a female athlete perform at their optimal. In conclusion, there are important differences between male and female runners, such as their body, which would include their anatomy and their biomechanical differences, the hormonal differences due to the female menstrual cycle, nutrition, training programs that should be tailored to the female athlete, and recovery, which is essential not only to injury prevention, but also performance enhancement. Thank you so much for joining me today, and I look forward to having you join me again sometime in the future. Bye.